Hypernatremia, that is high sodium. Hypernatremia is defined as okay, so before that, dietary requirement of sodium in children is 2 to 3 milliequivalents per kg per day. 1 to 2 milliequivalents per kg per day is potassium requirement. Hypernatremia, that is high sodium concentration. How much high? More than 150 milliequivalents per liter. Most of the children with hypernatremia are dehydrated and show typical clinical signs and symptoms. So, most of the time, high sodium concentration will have its own clinical symptoms. Children with hypernatremic dehydration tend to have better preservation of the intravascular volume because of the shift of water from the intracellular to the extracellular compartment. This maintains the blood pressure and the urine output, and it allows the hypernatremic infant to be less symptomatic initially and potentially to become more dehydrated before medical attention is sought. Okay, so what is happening is, uh, so the blood vessels, which is like the ECF, right? The ECF is going to have a lot of sodium. So a lot of sodium attracts a lot of water. Where will the water come from? The intercellular fluid. So the ICF water enters into the ECF. So what happens is the volume of blood within the blood vessel, that is nothing but the intravascular volume, that is going to be preserved until the late stages. Also it is going to be preserved. So a lot of blood is present in the body, like inside the blood vessels, meaning a lot of cardiac output is going to go to the kidneys, so the urine output does not suffer any way, and also the blood pressure is maintained very well. Okay, so here like symptoms are not there, right, as of now. Probably because of the intracellular water loss, the pinched abdominal skin of a hypernatremic dehydrated infant has a doughy feel. So you just touch the person and we know the person has hypernatremia. It feels like a dove, that is like a marble. And then hypernatremia causes CNS symptoms. Why? Because the brain will shrink, neuronal shrinkage. So that causes nausea, which is a GI symptom. And then otherwise, CNS symptoms will be there like lethargy, irritability, weakness, weakness. Okay, lethargy, irritability, and weakness. And then with respect to the ENT, there is high pitched cry and hyperpnea, and high pitched cry. And then generally, if you are going to touch the child has fever. Okay, so the GI, there is nausea, there is fever, there is doughy feel, and then and then irritable, and then lethargy, high pitched cry, hyperpnea. So basically the child looks like it has fever, and then it's lying down, and then it does not want to get up, which is lethargy. And if we ask the child to get up, it's going to yell at you, so irritable. And also it's going to start crying, and then it's going to give some breath holding spells and all. So that's hyperpnea. So that's how the child with hypernatremia present. Hypernatremia is often associated with hypoglycemia and mild hypocalcemia, meaning so when the sodium in the body is very high, glucose is utilized, calcium is utilized as well, which is why glucose level and the calcium level will become reduced. Brain hemorrhage is the most devastating consequence of hypernatremia. It may be a subarachnoid hemorrhage, can be a subdural hemorrhage, or it can be a meningeal hemorrhage. There's a strong correlation between cerebral palsy and history of neonatal hypernatremia. So the person, if the child has hypernatremia during the neonatal period, it's going to have cerebral palsy also. So there's a very strong correlation. Seizures and coma may occur. Seizures are more common during the correction of hypernatremia. Although CPM is classically associated with rapid correction of hyponatremia, it can occur in children with hypernatremia as well. Central pontine myelinosis. Okay, so that was about hypernatremia. The second part alone. Complications include brain hemorrhage. Brain hemorrhage can be subarachnoid, subdural, meningeal. Apart from that, neonates, like it's kind of like a long-term consequence. For example, if the child has hypernatremia immediately after birth, that is the neonatal period, it has this lot of sodium in the body. It's going to develop. There's a high chance of developing cerebral palsy. Seizures and coma also occurs when we correct hypernatremia. Seizures and coma. Okay, so that is high sodium. Thank you.